Hi, my name is Gabriel. I'm a first aid instructor with the Red Cross and I'm also an emergency medical responder. So today I'm going to be teaching you how to perform CPR and use an AED on an unconscious patient with no findable pulse. Okay. The first thing you want to do is you want to make sure your environment is safe. So either you've seen this person collapse or you haven't. Either way, you're going to want to make sure that the scene is safe for yourself to be able to help this person. Right? So after you establish it's safe, or you've seen that there's no threat to yourself, you're going to want to assess breathing. The way you do this is you place the head about 2 to 3 inches over the face of the victim, as so. And when you're doing this, you're looking down the chest. This is for the 3 ways for feeling for breathing, for listening to breathing, and for seeing the breathing. Seeing the breathing by the chest rise and fall. Feeling for the breathing by the air coming off your chin, hitting your chin, and hearing the breathing by hearing the breaths as you're over the face. So after you establish that they're not breathing, and you've checked their pulse through either the radial or the carotid pulse. So the carotid pulse is right under the neck, and your radial is right on the thumb side of either arm, right against the tendons. After you establish that there is no pulse or breathing, we can assume this person is in a cardiac arrest. We can perform CPR. So as soon as that is established, first thing you want to do is go under the armpit and come across. This is called the nipple line. This is where you want to make sure your palm is in the center of the chest on the sternum. This is where the compressions will be the most beneficial to them. So after I do that, I got my positioning. I'm going to want to make sure I do cycles of 30 compressions per 2 breaths. And of course, while I'm doing this, any bystanders that are nearby that I can use to my assistance. So if I'm near any government buildings, if I'm out and about at a library, they should normally have an AED, which is a defibrillator. This sends electrical shock through the heart, stopping the heart to enable itself to restart itself. It scans the heart with 2 pads. It works sort of like a very basic ECG. So as I get somebody to get an AED and as well as call 911, I'm going to start CPR. So go to nipple line, go to the center of the chest, and I'm going to want to start the CPR. So I'm going to do 30 compressions and then 2 breaths. So after the 30 compressions, you want to deliver 2 breaths. And the way the compressions are delivered, it would be 1/3 to 1/2 of their chest depth, as well as to a beat of, this might sound a bit weird, but staying alive or row, row, row your boat. So if you can imagine it, like row, row, row your boat gently down the stream. So as long as you have that sort of rhythm, little key tip, don't start singing that while you're doing the CPR. That can look a little bit bad on yourself. And make sure you're always verbalizing what you do. From when you start to when you finish, you want to make sure people around you don't think that you're trying to do anything weird or trying to hurt this person further. You want to instruct that you know CPR, or you get classes to go instruct further. But this is strictly for emergency situations. So I deliver the 30 compressions. And I want to tilt the head back. Right? I want to pinch the nose, and I want to deliver 2 breaths. Now, there are things like the CPR face masks that are in most first aid kits, and those are pretty self-explanatory. You open them up, and there's a side upside down. You use them, just cover the mouth with it. But since I don't have it here, I'm not going to use them. So, 2 breaths. Okay, 2 breaths are delivered, and then I want to start compressions again. So, 30 compressions, then another 2 breaths. 30 compressions, another 2 breaths. So, as I continue this cycling, I'm basically waiting for 911 EMS to come, or I'm waiting for an AED. So, let's say 911 is on the way. They're 5 minutes out, and I get an AED. So, let's wait. I have my handy dandy AED right here. So, when it comes, it'll come in a little bag with a little first aid kit and a little to use to help you out when it comes to pads. So, the first thing you want to do when you get a kit is you want to come with scissors. And what you want to do is you want to cut the shirt off the person, going the seam right down the chest. You want to make sure that's out of your way. Next thing you want to do is you want to make sure there's no jewelry or anything metallic that's going to be through the current, which will be to the shoulder to below where the ribs are. They're indicated on the pads, and the AED talks to you for the whole way. So if there's any part of this that you forget, the AED will run you through it. Okay, so I'm going to make sure I plug in my electrodes, which are the pads that are going to go on the person. Those are in. I want to make sure I follow the instructions indicated on the pads. So the one over the right pectorals. One, and then on the left ribs. Okay, now that my pads are on, and also another thing to mention, if they have any hair on their chest, there's going to be a razor blade in the first aid kit. You want to make sure you get rid of any hair so it has direct contact with the skin. Correct? So it's on. You want to turn on your AED. Now, when you turn your AED, it's going to be talking to you. So it's going to say, analyzing, please step back from patient. So as you're doing this, you want to make sure CPR is happening as much as it can, as fast as it can. While you're doing this, you're going to jump on CPR until this thing instructs you not to do CPR. So it's going to say, analyzing, please step back from patient. This is where it's going to read the heart rhythms. So you're going to step back, make sure no one's touching him, and let read. And after that, it's either going to say shock advised or shock not advised. If in this case it says shock advised, you're going to want to get back on there as soon as it instructs you that shock is advised, because it's going to be charging the shock that's going to be delivering. So you want to get back on, continue your CPR, 30 to 2. So I'm continuing. It says shock charged, please administer shock. So at this point you want to step back from your patient, you want to move back from your patient. You want to make sure that no one else is touching the patient. So you want to say, everybody clear, everybody away. As soon as you can confirm nobody is directly touching the patient, you can administer the shock, which will be indicated by a flashing button. Shock will administer, there'll be a little bit of a convulsion, and then you can get back on CPR until this AED tells you not to. This AED is going to stay open and working for a couple checks. So as much as you need to use it. Another thing I have to mention is when you're using an AED, you want to make sure that it passes the splash test, where if there's any kind of water around or anything like that, if you can get some sort of object like a coin and throw it in and it doesn't splash, you are fine. You can use an AED. If you throw something down and it splashes, and this is directly touching the person, you would want to probably move the patient as well, because you wouldn't want to shock yourself and anyone else around. Yes, so after 32, 2 breaths, 30 compressions, that's CPR. Have fun saving your life.